Dr. Jennifer Warren, a health communication specialist at Rutgers University, is here to talk about how the health literacy, or lack thereof, among adults significantly impacts the health of our children. Dr. Warren, thanks for coming on board to share with us. It's interesting. What we know, obviously, is easier to share with our kids, but what we don't know also can have a big impact on our kids' health. Absolutely.
And there's a lot, excuse me, there's a lot that people do not know about smoking and children's exposure to smoking. And that's why health literacy becomes such an important factor. You know, I was looking at some statistics before I came to the show, and it said something like 700 million of the world's children are exposed to secondhand smoke. And out of that, 50% are sick due to this exposure. And sickness includes respiratory symptoms such as coughing, sneezing, and wheezing, and also respiratory illness or infections, including bronchitis and pneumonia. And secondhand smoke can also be a core risk factor for asthma in preschool children. So that's a lot of stuff that can impact our world's children. And so parents many times, you know, think when they smoke, they're only hurting themselves.
And that's not the case.
That's not the case.
So how do we get the message to parents that, you know, this is not just, oh, stand a few feet away from the kids or put them in another room? I mean, they really downplay the impact of secondhand smoke. How do we get them to understand how dangerous it is?
And that's a very interesting part of health behavior change. How do we motivate people to do something about it? Knowledge is key. Understanding the risks are key. Another statistic I was reviewing is that 776 million parents or 76 million adults don't understand basic health information. So if you have groups of people that don't understand basic health information, we have to think about what formats, how do we get this information across to them? And so it's just about education, education, education. When people say, oh no, all they need to know is that it's bad. No, why is it bad? There are 4,000 toxic substances in secondhand smoke.
And of course you have the big villain to conquer, which is the marketing budget for the tobacco companies.
And there's no way we can match that. Absolutely no way. And so much of my work has been going into communities, helping to mobilize parents around issues, not so much of exposure to tobacco smoke, but around issues of respiratory illness in their children, like asthma and allergy-like symptoms and bronchitis, pneumonia, acute ear infections, which are also a big issue for preschoolers. So we try to educate them around these issues because we would like to think that parents want their children to be healthy. And so by providing information about the outcomes or symptoms of secondhand smoke exposure, we can get a doorway in. But it's really also about teaching the skills. Okay, so you know that secondhand smoke makes an impact. We have to teach skills. So is a skill only to just not smoke around your child or smoke when they're not home? No. What needs to happen? People need to quit.
And of course your job's much difficult in lesser developed communities, for lack of a better word.
Absolutely. When we think about lesser developed communities, low income, inner city, rural, there's also countries that are low income that have high smoking, Somalia, Iraq, Afghanistan, places like this. It's very difficult sometimes to go in and talk about secondhand smoke when indeed there are much larger issues that impact what they do. I know in one study we were involved in, one of the parents, who was a single father, sat at the table with a group of us and said, you know, this really seems nonsensical. He didn't use that word. You know, this really seems kind of dumb.
In the face of everything else.
In the face of no housing, no work, and this and that, liquor stores in every corner. What are you going to do about that? So definitely there are some larger things that are at play that can really impact our ability to make an impact on secondhand smoke exposure.
Real quick, what do we say to parents about this issue?
Well, we say to parents, if you're not going to quit, smoke outside. Don't smoke around your child. For goodness sake, don't smoke in your car, ever, even if your child's not in the car. Realize that if your child's getting a lot of ear infections, if they're coughing a lot, that your smoking may be actually impacting them.
Wow.
So look towards symptoms such as those. And another thing would be get help. There are lots of places where they're offering comprehensive tobacco control, like quit services, free medications. Find these places out and seek to quit, because ultimately your health is at stake as well as your child.
Great way to end it, Doctor. Thanks a lot. We're out of time, but we'll bring you back. We'll have talk some more. Great message.
Thank you. Thank you.
Thanks for joining us.